To order this meeting of the Animal Rehabilitation Task Force of the Veterinary Medical Board. And we will start the meeting with a roll call and establishment of a quorum.
Dr. Nunez?
Here.
Lee Heller?
Here.
Dr. Klingborg?
Here.
Karen Atlas? Here. Sandy Gregory? Kristen Hagler? Here. Spring Holland?
Here.
Carrie Schlachter? Here. Dr. Sims?
Here.
Dr. Troy?
Here.
Dr. Van Dyke?
Here.
Dr. Waldman?
Here.
Dr. Chow?
Here.
Shala Bar? Here. Bill Gage?
Here.
Carrie Ann Calais? Here. Valerie Fenstermaker?
Here.
And we have a change to the assembly consultant. It's Alyssa Silva.
Here.
Thank you.
I think that establishes a quorum. Welcome, everyone. And I'd like to thank everyone for coming to our third meeting. I'm very proud of what we've accomplished so far, and I'm sure we're going to continue that trend. What I'd like to do is to first start out with just a little bit more introductions, if everyone can restate their name and let us know what your credentials are. And the last thing I'd like to know is if you've seen the movie La La Land, and did you not love it? So I'll start with myself. I'm Mark Nunez. I'm a small animal veterinarian practicing in Hollywood, California. Of course, I loved La La Land. And a member of the Veterinary Medical Board, the past president.
Anne Marie Delmanayo. I'm the executive officer of the Veterinary Medical Board, and at the risk of offending my former EXO president, I did see La La Land. The singing and dancing was wonderful. The storyline was a little cliche.
Lee Heller, public member of the California Veterinary Medical Board, high volume consumer of veterinary services, and wannabe viewer of La La Land, but my friend has not been able to find her Academy copy.
I'm Paul Yan Chow. I'm a small animal surgeon practicing just orthopedic surgery at UC Davis. I've not seen La La Land. I wish I have time, but with a 19-month, it's a bit hard.
My name is Kristen Hagler. I'm a registered veterinary technician and certified canine rehabilitation practitioner, and I am here to represent the proposed Academy of Physical Rehabilitation Veterinary Technicians. And I have not seen the movie. I am sorry. I've watched other cartoons right now.
I'm Erin Troy. I'm a small animal practitioner in Walnut Creek. I am a certified veterinary pain practitioner and a certified veterinary rehabilitation therapist. I have not seen La La Land, I'm sorry, Dr. Nunez, but it will be high on my priority list for next week.
My name is Jessica Waldman. I'm a veterinarian. I'm a certified canine rehabilitation therapist and certified veterinary acupuncturist. I have a small animal practice where veterinarians and physical therapists work collaboratively, just seeing rehab patients. I have seen La La Land. Not only did I see it, I have wonderful dreams about it, and I love it. I want to see it again. So.
My name is Shala Bar. I have several certifications in human massage and bodywork. I am a small animal massage practitioner and a certified canine fitness trainer. I did not see La La Land. It wasn't on my list. I don't feel a need to apologize for that.
My name is Carrie Schlachter. I'm an equine sports medicine veterinarian in Petaluma, California. I'm a diplomat of the American College of Sports Medicine and Rehabilitation, and I have also not seen La La Land.
I'm Carrie Ann Calais, and I'm a consumer. I haven't seen La La Land because I've been watching MSNBC and CNN nonstop since November 9th.
Kurt, do you want to, I really want to know if you've seen La La Land.
Good morning, everybody. Kurt Hepler, Supervising Council. Regrettably, I have neither turned to small or the large screen, given the devastating breakup of the Flipper Flop franchise.
My name is Dr. James Sims. I'm a physical therapist and an associate professor at Loma Linda University for over 25 years, involved in physical therapy education, physical therapist assistant, and also the orthotics and prosthetics program at Loma Linda now. I have not seen La La Land, but I've watched almost every playoff game in the NFL. And in consumer, utilizing veterinary services as a dog owner.
My name is Karen Atlas, and I am a licensed physical therapist here in California for about 20 years now. am also certified in canine rehabilitation, and I am and have been doing canine rehab for the last 8 years. I represent the California Association of Animal Physical Therapists, and I do have a copy of La La Land, but I haven't seen it yet.
I'm Janet Van Dyke, veterinarian and diplomat of the American College of Veterinary Sports Medicine and Rehabilitation. I represent Canine Rehabilitation Institute as well as the college. I flew in from Brisbane this morning. I thought this was La La Land.
I'm Dr. Spring Holland. I am at Western University. I am a certified veterinary acupuncturist and a large animal internist, and I have not seen La La Land.
I'm Valerie Fenstermaker, Executive Director of the California Veterinary Medical Association. I have not seen La La Land, but Mark, you've told me several times that I am going to love it, and I believe you. I'll see when I see it.
Sorry, Alyssa Silva with the Assembly Business and Professions Committee, and I have not seen the movie.
My name is Bill Gage. I'm with the Senate Business Professions and Economic Committee. I have seen La La Land with my wife twice. May see it again. So you know.
Don Klingborg, small animal veterinarian from Merced, California. I just saw the Broadway musical Rent. It's its 20th anniversary, so I look forward to La La Land in 2037.
Can we get the Wi-Fi password? So if anyone needs it. Wireless 123 exclamation point. Correct?
Okay, with I think with all the dancing that was in La La Land, I think a lot of those dancers probably needed physical therapy after the shooting. But at this point, I'd like to turn over to Bill Gage, who had some opening remarks.
Thank you, Mr. Chairman. Since it's our last meeting, at least I hope it's our last meeting, I wanted to thank you all on behalf of the Senate, and I think it's speaking on behalf of the Assembly, for your time and commitment to serve on this task force. Special thank you to the staff and Anne-Marie for all your efforts in providing support to the task force. I know Anne-Marie and I have had many conversations, and a lot of time went into providing us with the materials. There was concerns by us. As you know, this was a recommendation by us to create this task force so that the important issue could be more fully discussed by those who would be most affected by any attempt to regulate the practice of animal. There was a concern by us that because of recent case law, that board decisions or regulations might have a very negative impact on those who are performing animal rehabilitation, must be fully vetted. It's also required that we provide appropriate oversight of those decisions or regulations. I believe by convening this task force, we will be meeting those legal requirements. Having watched the first meeting with Nicole from my office participating and having sat through the last meeting, I believe that this task force has done an excellent job of dealing with this issue, fully discussing the different approaches to animal rehabilitation and making recommendations which will go. By the way, I just want to let you know that Nicole, who was our Senate fellow, she's now in Washington, D.C. And she just got accepted to Harvard Law School. Happy. We're really happy for her. I think we are now at a crossroads in our discussion, the relationship between veterinarians and other practitioners when providing animal rehabilitation. In particular, that between veterinarians and physical therapists. I believe last time we seemed to be in a rush, though, to cut off this discussion and seemed to move right away into a motion. I would ask the members if we could hold off on a motion this time until we have heard not only from the task force members, but from the public as well. The last thing I want to address is a recent letter sent by the California Veterinary Medical Association raising the issue as to whether certain members of this task force should recuse themselves from voting on motions because they may somehow profit from the decision. I am really surprised that this request was made by CVMA, asked for legal counsel of the board to address. First, I want CVMA to realize that we, the legislature, signed off on the composition of this task force, and we felt that it was adequately represented the professions and those who were most impacted by decisions of the board regarding animal rehabilitation. Everyone to have an opportunity to speak freely and to make recommendations to the board. In terms of whether someone should recuse themselves because of conflict of interest, we are guided by Section 650 of the Business and Professions Code. Not see any problem with placing persons on a task force that made only recommendations to a board, even if they might have some special interest in the outcome. Those in the profession could benefit as well from recommendations that come from this task force. I want to let you know that I personally could benefit. My wife and I do rescue on horses and dogs. I want to tell you what my vet bills look like, but the ability to seek other important alternative therapies would be important to the both. I think Anne Marie has a response from the board's legal counsel, but I just want to state for the record that I do not appreciate the attempt by CVMA to undermine the work of this task force. I don't think this task force should waste any more time on this request, and I'd be more than happy to meet with CVMA in my Capitol office if they have any more concerns. With that, I just want to again thank you all, the members of the task force, for the hard work that you have done and the informative discussion there has been at each meeting. I know we have learned a lot, and it will help us, the legislature, about how this area should be regulated. Thank you again, Anne Marie and your staff, for all their hard work. For our chairman, I want to thank you for your guidance, your leadership, patience especially, and conducting this task force. And I enjoy serving with my current chair on the B&P committee, but I've certainly enjoyed serving with you. With that, I close. Thank you.
Thank you kindly. I'd like to make a small change in the order of the agenda. I'd like to switch the order of 6 and 7, if I could. And the reason is I think that that would flow better. And if you recall at the last meeting, what we had decided upon was that there were 5 categories of professionals that were going to be included in the animal physical rehabilitation discussion, and those were veterinarians, RVTs, veterinary assistants, physical therapists, and physical therapy assistants. And then for each of those categories, we were going to talk about the educational and training requirements for each of these levels, each of these job categories, the level of supervision, whether that's direct or indirect, and also discussion of the practice setting. We did 3 of them, and we still have physical therapist and physical therapy assistants. I'd like to continue with that model that we did at the last meeting, and to do so, I think it just would make more sense if we just switched 7 and 6, but also acknowledging that in the discussion, we probably will be talking about agenda item 9D, supervision, and 9E, practice settings. I can just decree that. I hope that makes sense to everyone. It's an executive order, yes. So agenda item number 3, review and approve the minutes from the October 4th task force meeting. Atlas.
Thank you. There are, in the minutes, I wanted to make a couple of corrections on some inaccuracies that I perceived. And then there are quite a few other additions that I would like to be included in the minutes. So I have a list of things that I'd like to see included, and I have some of the timestamps for them to get them fact-checked after this meeting is over. I don't want to take up a lot of time in doing this, but so the ones that I want to point out in terms of true inaccuracies are on page 4, where it discuss how Ms. Del Magnayo inquired how many physical therapists are practicing in each of the states that I reported about. And it said that she was informed by the executive directors at the forum that the numbers were less than a dozen providers in each of these states. I couldn't find that in the transcript or in the podcast when I watched it back, and in what I heard, what was actually stated was that she said, I think it's fair that we keep in mind we're not talking about 10 to 15,000 practitioners, we're talking about maybe a handful. So again, complaint data, when we're talking about such very small select populations, it may be hard to extract a lot of good data because it's such a very small sample. I don't know from all the other states how many. I just know from the EDs that I talked to at the meeting, there's few practices in the specialty field on physical therapy on animals. So it's minor, but it's just an inaccuracy. I noted that there was no number on it, and it was not actually stated as such. The other inaccuracy that I noted was page 11. It had me saying, Ms. Atlas commented that it is irresponsible to allow physical therapists without advanced training in APR to provide services under direct or indirect supervision. I would appreciate that if that would be stricken from the minutes because it's inaccurate. It doesn't really capture the spirit of the point that I was making. I think the rest of that is fine, but I would love to see that taken out of the minutes and instead just say the rest of it. Ms. Atlas stated that this discussion is about consumer protection and access to care. She stated that it's important for a PT to understand their limitations and be trained to recognize when to refer back to the veterinarian for any medical issues. And then I would like to see included, which is why it is critical to get the additional training to learn the red flags and when the case should be referred back. So those are the two actual inaccuracies that I noted, but then there are quite a few other points that I would love to see included. So they're not true errors in the minutes, they're more just omissions in the minutes that I would like to see included.
Okay, a couple of things. You have a copy of the changes that you'd like to make to the minutes that you can distribute to the task force members?
Correct.
And I think it would be okay if you can distribute that to the members.
Okay.
And what I would propose, and I'll let legal counsel chime in, might be difficult for the task force members to really truly recall what was said and whether or not these changes are accurate or inaccurate. And we're not going to have an opportunity to have a fourth meeting to review the changes. And I spoke to Ms. Atlas about this. What I would propose, if it's acceptable to the task force, is to submit these changes to the meeting to VMB staff for them to determine if those changes, they would review the webcast and assure that those changes accurately reflect what was said during the meeting. And if so, then make those changes. And then this is where I have to turn it over to Kurt. Do we vote on accepting the minutes as reviewed by the staff?
Respectfully, let me take a couple things in order. I don't know. I think the way to do it would be have whatever comments you can put and send them to staff. I think it would be final, kind of like we did with the smog check program several years ago. There was a final draft report, if that makes any sense at all. So I think you could, difficult for the members to vote on something, and we don't have another meeting to come back to ratify it. So I think you could have them submit, and we can check for inaccuracies and stuff like that. Respectfully, just so we understand each other, the minutes are an accurate historical representation of what happened. This forum right now, in my opinion, as a legal counsel, is not a chance where you get to say, here's what I meant to say, or here's what I thought I would have said, or here's how I want to shape my remarks. These are what you said and what the actions were. Going forward, if somebody said something, then they said it. It's on the internet. The minutes to the effect should reflect what actually happened, not here's what I meant to say. So going forward, members would respectfully suggest this is not the time to shape what you said. This is to make sure that these are accurate.
Are you okay with us distributing the changes to the task force members?
I think what the members could do is, if they have something that they believe is accurate, they can send it. They can send it to Ms. Delmanayo. Since we don't have an opportunity to come back and vote it, I think they would be released as sort of they would still be sort of draft, but would be the most accurate we could come to. Because we can't come back and approve them because we're not going to have a third meeting.
Okay. So is that acceptable to you if we accept your proposed changes and submit them to the staff to review the webcast?
Right. Just to clarify, so what I turn in for proposed additions, they will just be fact-checked by the staff, and if they demonstrate fact, they will be included? Is that what you're saying?
Yes.
Okay. Yes, absolutely.
We need to vote on accepting the minutes as drafted, or?
Seems to be a faulty nut behind the steering wheel here. I would respectfully suggest that the motion would be to approve the minutes as sort of proposed to be amended with proposed amendments, with the understanding that you're going to delegate to staff to take those minutes, to review the tape, to review the audio tape, to review the videotape, and then come up with a draft set of final minutes that are consistent with that tape. So we'll just record the actual historical events that happened.
Okay. Okay, so then before we do that, does anyone else have any additions or corrections to the meeting minutes?
Mr. Chair, would you like a motion?
Sure.
I move to do what Kurt said. I don't know that I can repeat it word for word, but I move to do that.
Do I have a second? It's been motioned and seconded to do what Kurt says.
Mr. Chairman, that's about the first time that's ever been said in my 53 years on this planet. So,
call for the vote, please.
Dr. Nunez?
Yes.
Lee Heller?
Aye.
Dr. Klingborg?
Aye.
Erin Atlas?
Aye.
Sandy Gregory?
Aye.
Kristen Hagler?
Aye.
Dr. Holland?
Aye.
Dr. Schlachter?
Aye.
Dr. Sims?
Aye.
Dr. Troy?
Aye.
Dr. Van Dyke? Dr. Waldman?
Aye.
Dr. Chow?
Aye.
Salah Bar?
Yes.
Bill Gage?
Aye.
Carrie Ann Colley? Valerie Fenstermaker,
Aye.
and Alyssa Silva.
Aye.
Thank you.
All right. Your package also includes the minutes from the June 20th meeting. We do not have to vote on that because it's already been accepted. So moving on to agenda item number 4, public comments on items not on the agenda. If anyone would like to come forward, please come forward and speak into the microphone and state your name, please. And you don't have to tell us if you like La La Land or not.
Actually, I want to speak of something that is on the agenda. Do I wait? So I go back. It's about physical therapists, so wait.
Any other members of the public wish to come forward? All right, then moving on to agenda item number 5, a recap from the October 4th task force meeting.
So in the documents that were distributed was the nomenclature that was approved in June, at the June meeting. I also recorded motions passed from the Animal Rehabilitation Task Force meeting in October and motions that did not pass from the meeting in October. I won't belabor this by reading all of them, but if anyone has any questions or comments, now would be the time.
Any comments from members of the task force? Any comments from members of the public? Seeing then, moving on to agenda item number 7, discussion of educational and training requirements for physical therapy.
I'm sorry, Chair Nunez. Back to the other agenda item about the nomenclature. There were instances in the last meeting that where motions were made that were then withdrawn. Does that get put on that nomenclature list, or is that just not approved? Gotcha. Okay, thanks.
But I think they're in the minutes, aren't they? They are in the minutes.
I actually didn't see them in the minutes, but I have them in my proposed revision.
Okay. I thought I saw them, but we'll make sure they're there. Okay. Else? And moving on to agenda item number 7, discussion of education on training requirements for physical therapists. This is pretty much where we left off at the last meeting. Anyone want to go first?
I might be ground zero for this discussion. This is Dr. James Sims, associate professor at Loma Linda University and 25 years teaching in physical therapy education, so I better have some area familiarity with this. I apologize to those who may have heard this previously. It's probably the third time that this body, or most of the people in this body, may have heard this announcement or discussion regarding the competencies and the areas of skill set that the entry-level physical therapist receives in their entry-level education. Back in February 2011, I was invited and came up and spoke in front of the CVMA, their Government Affairs Committee, and gave a handout and a PowerPoint presentation regarding that. And so my comments will continue to just alliterate what was mentioned at that time as you go from there. From a education standpoint, basically physical therapy education requires a 4-year undergraduate degree in a health-related science, biology, botany, exercise physiology. There are actually some pre-PT undergrad majors that they will undergo. Similar to the prerequisites, the 4 years of undergrad that a physician and a veterinarian will potentially have to endure to get admitted to a professional program in their course of study. Physical therapy then, therefore, afterwards, a professional study is a 3-year matriculated program. And within that, timeline-wise, unit accrual-wise, basically, it's about 118 weeks, 114 pre-professional credit hours, 124 professional credit hours, 90 in the classroom, lab, and 24 in the clinical education. These are units for education, so it's not clock hours, that's units, which are usually multiplied by 3 as we go from there. The A physical therapist, and probably a real good objective way to look at is looking at the CAPTE, which is the Commission on the Accreditation of Physical Therapy Education Standards. Every physical therapy program in the United States is accredited by this body. And so this is not just a California only. So this can work for any physical therapist who may come to California from other jurisdiction. And it identifies the standards required for elements for accreditation of it. And it talks in length, and I will make sure I record this so it's on the minutes, of all the coursework that the physical therapist has to complete and the curriculum that the program must cover. First of all, screening, to determine when a patient or client needs further examination or consultation by a physical therapist or referral to another healthcare professional. Second one, evaluation and examination and diagnosis. Obtain a history and relevant information from the patient-client from the patient or client and from other sources as needed. And then we perform a systems review to make sure that the symptoms that the patient is presenting is not masking a medical pathology. The selected tests and measures we do, and there's about 20 of them here, so bear with me. Aerobic capacity, anthropometric characteristics, assistive technology, balance, circulation, self-care, cranial-peripheral nerve integrity, environmental factors, gait, integumentary integrity, joint integrity and mobility, mental functions, mobility including locomotion, motor function, muscle performance including strength, power, endurance, and length, neuromotor development, pain, and I emphasize pain, and I'll comment on that in a little bit, posture, range of motion, reflex integrity, sensory integrity, skeletal integrity, ventilation, and respiration or gas exchange. We then are required to evaluate that data and instruct our students to evaluate that data from the examination to make clinical judgments and ultimately come up with a diagnosis. This is significant to note, and that is very different from a technician who's basically being told what to do and you follow these orders. The physical therapist is an autonomous practitioner. We are not independent from other medical practitioners that may collaborate in the care of the client or patient. Intervention, much time is spent in physical therapy education with the psychomotor side in terms of the manual and hands-on training, not by chance but by design. There are scripted and absolute timelines that the students must participate in learning how to handle their hands in treating patients and treating clients. Specifically, airway clearance, assistive technology, biophysical agents, integumentary repair and protection, manual therapy, including manipulation, mobilization, thrust, and non-thrust techniques, motor function, including balance, gait, patient and client education, and therapeutic exercise. And so it's a very comprehensive. We are hustling as an educator. I'm always working hard to get all the material in to make sure that our therapists are appropriate entry level and safe and efficacious practitioners. The certifications that are out there, there's a voluntary certification process from the American Board of Physical Therapy Specialties that will identify 8 specialty designations that therapists postgraduate can pursue. These include orthopedics, geriatrics, neurological, clinical electrophysiology, cardiovascular and pulmonary, sports, pediatrics, and women's health. So those are the kind of specialty areas. You also have other specialty areas, for example, lymphedema, ergonomic activities that are other independent groups that will put certifications programs together. And then I'll include, obviously, the animal rehab certifications that we have here in the United States. If I can now go to, unless there's any questions on that, I can go to item previously 6, now 7, in terms of the scope of physical therapy. Questions on our education?
Yes.
I did have some questions.
Yes.
Could you talk a little bit more, because this is a concern that's been raised in this task force, about the kind of training that physical therapists receive in recognizing medical problems, particularly the kinds of things that you then refer back to a medical practitioner such as a doctor?
Yes, with the autonomous practice here in California now, the physical therapist has the ability to be the point of access for patients who receive health care, direct access. We've always had that, and up until about 3 years ago, the then subsequent treatment application required kind of a clearance with a physician. That has now since changed. The legislature has recognized the value and the competency of the physical therapist to perform that activity. So we go through a screening process, a medical screening, a triage, to ensure that the signs and symptoms that the patient client is expressing is not masking or in true being a medical complication instead. For example, a patient who may have shoulder pain is a very common referral of a cardiac event that potentially could be occurring. And the simple question answers that any healthcare practitioner, whether it be the triage nurse in the emergency room or the physician, we'd ask the same questions in terms of the quality and what the onset, etc., for that thing. Shoulder pain only comes when I climb a flight of stairs. Well, that's probably not a shoulder problem. That could be a cardiovascular problem that needs to be cleared. And so we are obligated to immediately refer that. That's protection. That's part which you shall, not may, you shall refer to an appropriate medical practitioner. As physical therapists, we've had this direct access now for 3 years and have zero complications, have zero disciplinary actions brought up on that. So our screening part, it's the first question I tell my students, whenever you have a patient, the first decision you make, is this a physical therapy amenable issue or not, to treat or not to treat?
So, Dr. Sims, if I can just clarify, what you just described was the educational program that a person who wants to become a physical therapist goes through. At the last meeting, we talked about the curriculum at veterinary schools, and we learned that there's 2 veterinary schools in California that trains veterinarians. So what you described was the program that a physical therapist goes through to obtain a physical therapy degree and ultimately a license. Is that correct? Okay. Just out of curiosity, because I don't know, how many physical therapy programs are in California?
About 13.
Okay.
Yeah. 13 if I'm not mistaken.
Now,
the other thing that I want to emphasize, there are comments made erroneous, and it's kind of testimony. I mean, first rhetorical question would be how many of you folks here have received physical therapy? How many folks have been in a physical therapy clinic? And so it's amazing the ignorance, and that's not a bad word. People just don't know what we do, to be honest with you, in terms of the depth and breadth and scope of what we do. As we go from there. There are comments about physical therapist pain management made by a public member, a public comment. And I just kind of have to laugh at that comment in the sense that there's actually a course in the curriculum at Loma Linda called Pain Science. To make it out that physical therapists don't know about pain. We take classes, pharmacology is included in our curriculum. If you really want to learn a lot about it, come down to Loma Linda on May 2nd. The interdisciplinary symposium regarding pain with the Alumni Postgraduate Convention, which is the medical school's alumni weekend, has a seminar on pain, and physical therapists are lecturing in that symposium. So it's ludicrous for anyone to have portrayed that physical therapists do not know pain. The second thing that I will add to also here is that the comment I've heard that I am just taken aback at it is that, you know, the difficulty in terms of the challenge you have with the animal population as a human population is the lack of communication. If you ever tried to treat an individual who is intubated in an intensive care unit, you recognize the challenges of having to recognize other than verbal communication potential for the way people respond to the treatment you're applying. Sympathetic nervous system is key to that. The erector pili of the hair follicles are rising, the tone in the muscles, perspiration, and believe it or not, the capillaries, the pupil dilation or constriction are keys to me when I work in intensive care unit on a patient who cannot communicate to me about their ability to satisfactorily accept that treatment.
Okay.
And then the last thing is the stroke victim who is expressive and or receptive aphasic, who cannot, and you need to use hand gestures, you need to have palpatory skills to feel what their response is to the treatment. And so for us to say that physical therapists do not know how to treat a patient or client that has communication challenges is untrue.
Okay. Before I move on to Val, I just wanted to to clarify the question that was asked, you talked about the program that a person goes through, and it is very impressive, extremely impressive. And I don't want you to address the correlation between humans and animals, but in the course of physical therapy that a person goes through, are there any specific requirements that in order to graduate, you need to take specific courses on the specific differences between animals and humans? Or is that something that is not required to graduate and get a license? It's something that potentially other people can get additional training in?
The two comments on that, and I'll first answer your question and elaborate on it appropriately, is there's not a differential diagnosis between animal or human pathologies and items like that. A diarthroidal joint in a vertebrate, whether it be a canine or a human or an equine or a feline, it's still the same, diarthroidal, freely movable, hyaline lined cartilage joint. Skeletal muscle, cardiac muscle, and smooth muscle. So, in that sense, when you ask, do you get animal anatomy? In a sense, I get anatomy on the musculoskeletal system, which is common to both species, both all cross over to there. So do we get anything in terms of animal stuff? In terms of like what does a canine knee look like as compared to a human? No.
Okay.
That's the post-professional activities that the special certification person have, and that's why the CPTA and CAAPT has always said it's not the entry-level physical therapists that we're asking for this privilege of. It's those who then have continued education and specialization and certifications to then supplement that. But the psychomotor and the foundation is far greater depth than any of the other practitioners that we discussed that can do animal rehab at this level.
So to get that PT degree, there's no specific courses that you have to take that specifically talks about the difference. It's just assumed, correctly or incorrectly, that they're similar.
No, I'm not going to assume that either. I would let those people who are knowledgeable in that
correctly or incorrectly. Okay. I think we'll have Val and then Shala.
Since you brought up accreditation, I just wanted to talk about that a little bit because the accreditation process in the United States is quite comprehensive and is overseen by the United States Department of Education and the National Advisory Committee for Institutional Quality and Integrity. And there's a huge amount of oversight. The veterinarians, the accreditation is overseen by the AVMA Council on Education, and as Dr. Sims mentioned, the physical therapists are overseen by the Mission on Accreditation of Physical Therapy Education. And these are incredibly comprehensive programs that are important to the professions all across the country and to the boards that use them as in their licensing standards. So I went on the CAPT accreditation website, and they do mention the public, and we're talking about consumer protection. And it says on their website that the public is assured that accredited physical therapy education programs are evaluated extensively and conform to general expectations in the professional field. And in mentioning whether animals are addressed in the physical therapy accreditation, and that's the foundation for which a person is licensed as a professional, I have a hard time seeing that that is part of the accreditation standard in the United States. Veterinary education, if you go on the Council on Education accreditation standards, is all about animals. Every single imaginable part of diagnosis and physiology, I won't even go, anatomy, it goes on and on and on, and there's major oversight of these programs. So I think it's important to recognize, and it's been brought up before, that the basis of a physical therapy accredited program in the United States is to treat humans. And you might build on that, and I don't want to get into supervision or anything right now, but a veterinary accredited program, as we've said before, provides that foundation. And I think that accreditation is very, very important when we're talking about consumer protection, because that's what they're looking at. They may not be looking at it immediately, but if anything goes wrong, they'll be looking at it. Thank you.
Shala, and then Carrie Ann.
Dr. Sims, for that thorough explanation of the training that a physical therapist goes through to get their title. I have a question, I think probably more directed to Dr. Chow. The physical therapists go through an intensive training that's very specialized. Is there anything at your school that is equivalent to that?
Equivalent to?
This very particular training, this
So
physical therapy
I guess
training.
it goes back to the purpose of the education. So we're teaching veterinarians, we're not teaching physical therapists. So you cannot compare
Okay, so there's no
apples
program.
to oranges.
I guess what I'm asking, is there a program in your school that addresses something equivalent to physical
Yeah,
therapy?
I think I talked about it last
Yeah.
time, and it does
And if I
cover.
could-
No, and my understanding,
Yeah, I'd like
my
to just,
understanding was
I'd like
it
to
was
interrupt
elective.
this just 1 second, because we're actually not talking about the qualifications of veterinarians to practice physical therapy, because we've already covered that and voted on that at the last meeting. So I'd like to respectfully ask the members of the task force to focus on the educational and training requirements of physical therapists, and not focus on the education and physical requirements of veterinarians, because that was discussed thoroughly and voted on at the last meeting. Carrie Ann was next.
Yeah, hi. I just wanted to request that everyone pay special attention to speaking more closely into their microphones. That's because when I review the video of these proceedings, I've often gotten into trouble not being able to hear anything for long periods of time, or really having to stick my ear right on my computer. So I'm just hoping that people can speak a little bit more directly into their microphones, if that's okay.
Okay, I think I have John and then Dr. Choi.
So, as you pointed out, Dr. Nunez, at the last meeting, we spoke at length about the veterinary curriculum, and there were 4 specific questions that came up going back through the videotape. So, Dr. Sims, within the physical therapy curriculum, how many hours of lecture or laboratory do students receive on animal physical rehabilitation?
The physical therapists their whole curriculum is on rehabilitation, which you apply to a pediatric or a geriatric or any population can occur. Specifically, do we bring an animal into the lab? Not an entry-level education. That's one thing needs to be stipulated, Chairman, is that we're talking right now on entry-level physical therapy education. There's kind of been a bait and switch here by a previous speaker, and now this question that's trying to erode the quality. Yes, it is. Yes, it is. Don't nod your head no. And that if we can keep it on the entry-level physical therapy education, you have individuals here who are involved in the certification and the post-professional certification process that can comment on your question better than I can.
What percentage of the student body in physical therapy school is exposed to coursework on animal physical rehabilitation? This was the question that was asked to the veterinary students.
I'll say in entry-level education, there's not any.
Are physical therapy students trained to diagnose and treat animals?
No.
Are physical therapy students taught all of the modalities needed in animal physical rehabilitation?
Yes.
Okay. Thank you.
Boy.
Dr. Sims, first, I would like to apologize personally if you feel that I or anyone that I'm affiliated with has felt that physical therapy education is not as wide as you described. I have personally benefited from physical therapy and would probably not be walking if I had not. I have never, in this whole process, questioned the educational process that human physical therapists receive. My concern is this. You've just extrapolated a nonverbal stroke patient or intubated patient to my entire population of patients every single day. They're nonverbal. When my mother had her stroke and the physical therapy was working on her in the acute phase, she was surrounded by additional medical professionals, MDs, neurologists, RNs, a lot of other people. She was not just under the care of that well-trained physical therapist. So when you're talking about nonverbal patients in your student's population, would you say every single physical therapist has extensive training in nonverbal patients and how to work with them?
Yes.
So every physical therapist can work and has extensive experience working with nonverbal patients. In my world, that's 24/7 that we're working. That's every single patient I see. Can you tell me that every single patient your physical therapy students see is nonverbal?
The patients that they treat who are nonverbal, they will use the skill set that they've received to treat and to be able to have a communication ability with that person being nonverbal. That they don't see 100% caseload of that type of patient depends on the caseload that they may have.
So when you talk about all these impressive specialties areas of specialty that physical therapists can pursue, neurologic, pediatric, women's health, orthopedic, would you say the vast majority of those patients can speak to their physical therapist?
In the whole totality of the spectrum of the patient load that physical therapists can potentially see,
yes.
The answer would be there's a segment that do not have communication abilities. I don't know what number that would be in terms of that, but those individuals who do work in the neuro rehab or those areas, it may be their entire caseload is of that type.
For those specific physical therapists, but your
who are
physical
working
therapists
who are working in that specialty area.
Correct. So your physical therapists that are specially trained in orthopedics, for instance, would you say the vast majority of orthopedic patients they see are nonverbal?
No, they are verbal.
Dr. Nunez.
Ms. Heller, Carrie Ann.
Thank you. So I feel like we're getting a little bit ahead of ourselves here. Dr. Sims described the general training that physical therapists receive in order to receive their license in treating human patients. I have not heard anybody propose that someone with that qualification is qualified to practice on animals. On our agenda is a discussion of additional certifications and specialties. What I think we really need to hear about is that additional level of training that we are considering if we're going to look at the possibility of different supervision levels for people with a license in physical therapy and an additional certification. We have several experts in the room on that subject. Before we start arguing this out, I would really like to hear what that training level is, what those individuals learn in order to practice on animals with their differences from humans.
Carrie Ann and then Dr. Schlichter.
Yes, kind of following on what Dr. Heller was saying, I apologize in advance if this seems a little harsh, but over the course of the meetings that we've had, it's caused me a lot of concern that some of the task force members use an argument that, you know, if you haven't gone through veterinary school, how can you recognize pain in an animal that doesn't speak? This line of comments about what Dr. Sims was talking about. As a consumer, as a layperson, I look at this and say, veterinarians were once students. Veterinarians were once kids learning how to recognize cues, whether they're verbal, nonverbal, from animals, from people. People can learn, students can learn. A physical therapy student, given advanced training, can learn animal handling skills, they can learn communication, the psychology, the physiology, the anatomy of animals. Therefore, I think this whole argument that if you're not a veterinarian, you're not up to the job. I think that it's very important to realize that that I can't imagine just a physical therapist straight out of school wouldn't be pursuing specialized training as an animal rehabilitation therapist. So, you know, I'm very concerned when I hear that sort of comment, because it waves past a very basic assumption, is that intelligent people who are students and have pursued master's degrees, doctorates, they can learn. Thank you.
Okay, legal counsel needs to intersect here, and then it's
Right.
going to go to Dr.
Thank you, Mr. Chairman.
and
Members,
Carrie
sort of
Ann.
echoing with what Ms. Heller said, Respectfully, we're on agenda item 7, so I would suggest that the task force first exhaust, thanks to Dr. Sims' comprehensive explanation and description of what it takes to get a license as a physical therapist. I think the task force needs to exhaust any questions or debate on that issue. Then I think you can proceed to whether there's additional certifications and what it takes to get one of those certifications, and then there's additional specialties and what it takes to be, recognized as a specialist in the area. It seems like we're sort of getting into a little bit of a courtroom tactics about this or that, and so I would respectfully suggest going forward, why doesn't the task force exhaust if they have any questions about the basic licensure of a physical? Then we'll proceed to the next subject.
Dr. Schlechter, and then Christine Hagel.
Yes.
And
First,
Jessica.
thank you very much, Dr. Nunez. First, I'd like to say I actually agree with Carrie Ann wholeheartedly in that because I wouldn't be where I am today, being boarded if I didn't seek out education after veterinary school. I certainly didn't graduate with all of the knowledge that I have today, or that qualified me to sit for the board exam. However, I would like to go back to a point that was brought up, the third question, Dr. Klingborg, that you had about the modalities, physical
Yes.
therapy. Could you just repeat that for me?
The question was, are physical therapy students taught all of the modalities needed for
Okay.
animal physical rehabilitation?
Okay, and I know that modalities might mean something very specific, but in at least in equine rehabilitation, which is what I can mostly speak to, motivation is a huge part of that. And I don't see how a human physical therapy student can understand equine motivation and behavior. I have a really hard time believing that. Now that's not to say that they can't learn that, for sure. As I said, I fully believe with Carrie Ann, but to me, that is a huge part of the modality needed to get a 1,000-pound animal to do what you want. Veterinarians at least have some exposure and some opportunity during school to be exposed to that. And I'm not saying that they're any better or worse at the point of graduation than the average physical therapist, but to me, physical therapists do not graduate with all of the knowledge that they would need to use the modalities required for PTs to treat horses. That's all.
Okay. If I call you out of order, it's not intentional. Kristen?
I would just like to comment on our use of the word advanced credentialing or certifications, and specifically towards the pain management. There is a much more advanced certification, the Certified Veterinary Pain Practitioner, which is recognized by the International Veterinary Academy of Pain Management. Advanced certifications like the boarded sports medicine specialist, and then the future veterinary technician specialist in physical rehabilitation. So those, in my mind at least, those are considered advanced. And then the other ones that we will talk about, these certification programs, I just want us to be all aware of that.
Dr. Waldman.
So, staying on our topic about curriculum for PTs, Dr. Sims, radiology is included, right, for the basic PT education?
Yes.
Can you tell me what kind of imaging is covered?
What we do is because as a contributor to the care of the human, we don't take the x-ray, we don't read them, we can order them, and just like a family practice physician would order an x-ray by a radiologist, in the team approach with the patient and the client, you would have that occur by the practitioner who's best at doing that. Do we take them or read them? No, but nor it's like lab work also, read the results. But we have it in our act where we can order it. We just don't pursue. We don't, like a family physician, we wouldn't perform it or read it.
And then the same kind of question for pharmacology. What kind of education is there on pharmacology in the basic in the PT degree?
They have a whole course on all the interactions, the side effects, therapeutic dose in terms of therapeutic index in terms of concentration, etc., how it gets excreted, and the whole pharmacology, whole class on pharmacology.
So is it one class in pharmacology generally?
Yes. In Loma Linda. I can speak of Loma Linda. I'm familiar with their curriculum.
Okay.
Many other programs have, it is identified as a requirement. So whether one, they do 2 10-week courses, 1 15-week course, whatever it might be. We have PharmDs come in and give those lectures for us. It's part of that pain management course I'm talking to you about. That's going to be at Loma Linda in March.
Okay. How about wound care and bandaging as 2 separate questions? What's covered in that?
Yes, it's covered.
Both?
Yes.
So bandaging and dressings are covered
Wound
too?
care, it's a significant portion of what we do in physical therapy, yep. In our training, yeah.
So in those 3 topics we just discussed, radiology, pharmacology, and wound care and bandaging, how much of those subjects do you think are applied in, let's say, an ortho outpatient PT? Like, how much are they utilizing that?
I think it just depends on the patient load that you may have. I mean, if you're, I'm an orthopedic guy who does sports medicine, and I have a wound from a football game, I address it, I treat it with the skill set that I have. I can't tell you, the frequency of any particular clinic would have by chance.
So that's all really helpful, and I guess the reason why I think this is important, because in our rehab patients, we do have to read radiology, actually, whether it's the x-rays or the MRIs, we have to read them and we have to interpret them, and we have to give a prognosis based on that, which is something that only veterinarians are able to do. And if physical therapists aren't trained in that, I think that's a pretty big limitation in their practice. And the other thing is pharmacology. Meds from other conditions the patient is taking, meds in terms of pain meds, since most of our cases are pain management cases, are so relevant. And being able to understand how those meds might be affecting that patient that day, or maybe the side effects of an anti-seizure med might cause weakness, and the physical therapist or the vet who's doing rehab is working on getting strength and trying to really understand that complicated concept. The other thing is meds are not the same in people and in animals, and some of them are shared and some of them are different. We have a lot of medications that are unique, or our doses are unique, or the way they're absorbed are unique. So being able to really understand that and assess that and how that affects things really affects our therapy patients. And in terms of wound care and bandaging, you said it the same way I see it, which is an ortho patient might have a wound that day, or all the neuro patients have wounds because the pets are dragging their little feet and they get wounds on them. So addressing wounds, infected wounds, because guaranteed these are dirty wounds in pets, they lick them, they drag them in the grass, is part of daily practice in animal rehab. Now, addressing wounds is part of veterinary medicine. We have to do cultures, we have to prescribe antibiotics, we have to do all this stuff. So I'm really worried about the basic curriculum, and we'll explore if these 3 things are addressed in the additional certifications as well that PTs can get. But let me just finish.
Please.
But I am concerned that these 3 things aren't exceptionally well addressed in the basic PT curriculum, and how important those are for us every single day in our practice of veterinary rehab.
The connotation that then it's not important for us is ludicrous. I mean, when I have aseptic technique to do a wound care and a traumatic amputee on someone, those same aseptic techniques are that which would be applied in the animal rehab world that you describe, that I would, if it was an animal I was treating.
But you're not,
so,
but I don't think the PTs will be able to do that, because it is part of our veterinary scope. So
and
that's a gap in care that wouldn't be addressed.
Part of human integumentary care is aseptic technique, recognizing necrotic tissue, the smell of pathological tissue, and then the physician gets immediately called in that, as I would expect that the animal rehab physical therapist practitioner would secure the services of the veterinarian and say, hey, something's going on here. And so there are different responses to medications if you're diabetic or you're a senior person. Physical therapists learn how different medications are affected by different population types. It's like that. That they get that, the animal, again, please recognize this is entry-level education. Again, we're going off the trail, trying to do that. No, I'm going to finish because we've gotten cut off enough times. And that is that at the specialization certification, let them qualify in terms of their training in that area there. But to the physical therapist in terms of identifying viable tissue, how to put and what type of compression to put on it, what kind of bandaging and dressing, to say that they don't have that skill. We're treating humans. I mean, you cannot say, well, we're just going to kind of be good at it, because no, we are great at it in terms of taking care of them, and that carries over in terms of the other species we happen to treat with the different, kind of pharmacological responses to the medications that might be analogous to a diabetic patient in human versus a different age person. So, they're competent.
Okay, I have Dr. Cho, Shalabar, Dr. Van Dyke.
Dr. Sims, I just want to clarify a point that you made, that you say that the human physiology and kinesiology are essentially similar or the same to animals?
Well, I mean, from a kinesiological perspective, a class 1 lever is a class 1 lever, regardless of whether that is a knee of a dog or a human. In terms of the kinesiological principles, you have pennate muscles and fusiform muscles that act with the vector analysis, the same thing. And so when I'm looking at performing joint mobilization on a human, the same competencies in knowing what direction to glide that joint to increase range of motion of the arthrokinetic lesion of a diarthroidal joint, whether that be a joint in a human or an animal, would be, yes, the same.
Well, then I have to disagree with that. And as much as we know that it's impossible for a person who stands on 2 feet would be the same as an animal that stands on 4 feet. For joint motion that you mentioned, we have very good pronation, supination, but dogs only have half of us. And cats, they are similar to our pronation, supination. And horses, I think horse people can mention. The wounds are very, very different from cats and dogs and horses and human. They are like completely different things. So I don't think just assuming they're similar could apply it to all species. When I graduated from vet school, my dad asked me, so can you go treat human? I say, of course not, Dad. So when I finish my residency, I get boarded. My dad asked me, so now can you do surgery on human? I said, oh, hell no, Dad. There's no way, because there's no such assumption should exist. It's very, very different.
Shalabar, Dr. Van Dyke, Lee Heller.
I'd like to defer to Dr. Van Dyke.
Dr. Van Dyke, Lee Heller, Karen Atlas.
A couple of points to Kristen on the certifications. I think it's important to clarify that though the IVAPM recognizes the Certified Veterinary Pain Practitioner as an additional certification, it is nowhere near the level of a board certification, nor does the IVAPM suggest that. I was on the board and helped to develop the CVPP program, and it is a certification. It's a good program, but it is not board certification. So we can't throw it into that same category. I think that we're going to venture into the additional certifications. Most of my other comments then are related to the specifics of what PTs learn in those additional certifications.
Heller?
And that's what I want to remind us of. So my last comment was directed to the fact that we haven't covered a whole area of information that we need to assess. We're trying to make an argument about something that nobody's actually proposing, which is that someone with a physical therapy license is competent with no additional training or certification to practice on animals. So we're getting into an argument that we don't need to be having, and that is not helpful, at least to those of us who want to understand what the additional training and certification involve in order to then have a discussion about that body of practitioners and what role they can play. So can we do what Kurt said, because we said we would do what Kurt said?
I hear you. but people need to get things out. And I'm going to let everyone have that opportunity. Karen Atlas?
I just wanted to respond to Dr. Waldman in that you discussed about radiology and bandaging wounds and pharmacology. Those are also, you know, we're not saying that we can do all of that. We never have. The pharmacology, all we need to do is recognize things that need to go back to the veterinarian. So we look at, when the radiology comes in, we look at the radiologist report and look at what the specialist, the boarded radiology veterinary specialist gives us. And, you know, I certainly trust a boarded radiology report from a veterinarian. And so we don't need to read those reports. We don't need to know how to interpret an MRI or a CT or a plain film. We do need to understand the implications of what that boarded radiology veterinarian have said and understand what that means, and we can go from there. But we're not saying that we need to order those tests. We aren't saying we need to interpret those tests. We leave that up to the appropriate doctor whose job it is to do that. And in my practice, it's the reports that I get are from boarded radiology veterinary specialists. So I don't look at that as a task that we aren't trained to do that. It's not in our scope. I mean, we can understand certain things, but that's not our main wheelhouse, and we trust that the actual boarded specialist is giving us the information that's needed. So that is a veterinarian job, and we know where our limitations are, so we go by what the veterinarian says. So I don't know why that would be a barrier. Secondly, same with pharmacology. We aren't prescribing medications. That is a veterinarian's job. We need to recognize the problems that could be going on that need to go back to a veterinarian. And that is where we are trained. And we're trained to recognize the red flags, the medical red flags that can happen, to get them back to the veterinarian specialist so that they can get the right medical care, because we don't give that kind of care. That is out of our scope of practice. We understand our limitations. We're not prescribing medications. All we need to know is, at that level, is to know our limitations, be able to recognize the red flags, and get them back to the veterinarian. So I don't think that those are things that are needed to be argued. We're not saying we can do those things. So I'm not exactly sure why that is looked at as a potential barrier for us to be treating in this realm, because we work as a collaborative allied healthcare system, and when we know and understand our limitations and we're able to recognize what is out of our scope and we send them back to the veterinarian, that is appropriate practice in my mind and should not be a barrier for us to be able to treat in this circumstance.
Okay, at this point, I would like to say that I think that we actually all agree, and I think that it might be the potential of having a unanimous vote for the first time, or maybe we had a unanimous vote. And these are excellent questions, and task force members are reminded that we're asking these questions because all of us agree we want these animal patients to receive the best possible care, and we want the consumer to be protected. So I'm going to allow the task force members to say more, and also the audience, but I have a possible first motion for you to entertain, and that is that only physical therapists that have completed additional training in veterinary medicine as it would relate to the unique differences of performing physical therapy on animals when compared to practicing said therapy on humans shall be allowed to perform physical therapy on animals. And I do acknowledge that we need to talk about that specific training still, but I'm just going to throw that out there.
Chair Nunez? I'd like to refer to Mr. Gage's recommendation at the beginning that we withhold motions until we've had a more full discussion of all the issues. This just seems a little premature to me.
I hear you, but I was boldly thinking that we have had a lot of discussion. And maybe it's time to move forward to some thought.
And I agree with the chair. I meant as to each issue that we're dealing with. At the issue, but that we're focused here on additional education for this purpose. I think it's appropriate for a motion at that time.
So that's not a motion on my behalf, it's just a thought that it could be a motion. Dr. Waldman and
I would love if you could put that motion off until after we talk about the additional certifications that physical therapists may get, because I think that may alter some of our votes on that motion that wasn't actually proposed.
Might I also ask a clarifying question? So as you phrased it, which I'm not sure, since it's not a formal motion yet, physical therapists without additional training wouldn't be allowed to practice on animals. Would that include not even in a direct supervision setting as a veterinary assistant, which could be problematic for practices like Dr. Waldman's?
Well, we've already talked about what veterinarians, RVTs, and veterinary assistants can do. What we're focusing on is what physical therapists and physical therapy assistants can do. And right now, there's no language at all that they can do anything on animals. So that's what we're potentially making a recommendation for. And to Dr. Waldman's point, I completely understand that we need to talk about the additional training, but I was hoping that we can come to a consensus that all of us believe that additional training, as Dr. Sims reported out, these are entry-level physical therapists. And I don't think that anyone on the task force thinks that an entry-level physical therapist, after completing the program that Dr. Sims described, would be qualified to practice physical therapy on animals. And so what I was proposing was pretty much that.
I have another way that you could say that, that's the inverse or converse of what you said, which could be that physical therapists without additional certification or training may not practice APR.
Way of saying the same
But it is
thing.
a different, but it's also a different.
Even in your practice under your direct supervision? Because that would exclude your own current employees. Is that what you're saying?
It doesn't exclude mine, but but yeah,
And
I'm just saying it's a different statement. I was just trying to help.
And I would remind task force members not to speak out of turn, please. Joe.
My only question is, we already discussed that animal physical rehabilitation is a practice of veterinary medicine. So does that just already cover what you said? Because physical therapists, they're not licensed to practice veterinary medicine. So I don't even know if we need to have a motion.
Well, that would certainly close the door, which I'm not in favor of, but it's one thought. Klingborg?
I'd like to go up 10,000 feet on this for a minute. The agenda item is scope of practice for physical therapists, and I want to just talk about scope of practice for a minute. I think that we can look at the skill sets that we have in allied professionals like physical therapists. And Kurt, I see you're ready with your microphone over there.
Dr. Klingborg, we're on 7, flat out 7. Is it board's desire to go back to 6 or tackle 6 at the moment?
Am I in the wrong agenda item?
Yeah, we're talking about educational and training requirements for physical therapists.
I'll wait then.
Roy.
Thank you. Can we get to the specifics of the training that the physical therapists go through? We have one of the 2 certification schools represented here by Dr. Van Dyke. We don't have the other one, but could we at least understand what the training the physical therapists go through from beginning to end when they come out of with their foundational program before they're proposed to be working on animals?
Hello?
I want to echo that and say I'd be interested in learning about the additional training that they go through whatever school, whether it's UT or CRI.
Okay. Then, in relating to this additional training, I think we have some experts in the room that have some knowledge about additional training.
Mr. Chairman, if I could, just following along, I would first ask respectfully that the task force determine that there's no other questions or discussions or debate needed on requirements to get to licensure. That'll be the jumping off point to get to the next discussion. So perhaps we would see if there's any public comment or questions, final questions from the task force about what's necessary to become a licensed physical therapist.
Okay, that's a good point. The task force has talked about the educational and training requirements of a physical therapist and have raised some very good points, and we've heard some very good responses. Is there, in specific to that issue, are there any comments from members of the public? Come forward, state your name, let me know if you liked La La Land. Ah. Okay.
Fabulous. My name is Jamie Payton. I'm actually a small animal veterinarian. I am a diplomate of the American College of Veterinary Emergency and Critical Care, as well as I'm a certified canine rehabilitation therapist. I'm certified in veterinary acupuncture, certified in veterinary chiropractic. I'm currently the chief of service for the integrative medicine service at UC Davis, as well as I am currently a founding member for the Center of Advancing Pain Relief. So I wanted to comment about, because I really...
Just speak a little bit closer to the microphone.
Sure. I have a very soft voice. So I wanted to just comment on the education for physical therapists, because I really enjoyed the comments that Dr. Sims had, because education is very important to what we do. And, you know, I'm in a little interesting situation because I actually, the Center for Advancing Pain Relief that I am a part of is actually an interprofessional group that focuses on pain, and he brought up pain. And really what it does is brings all the professions together, both veterinarians, medical doctors that specialize in pain medicine, anesthesiology, pediatrics, as well as physical therapists, nursing practitioners, all different groups. And the key is we all can contribute to helping pain. And there is, you know, an underlying, that we all experience pain. But there's a big difference between, you know, animals and people, even regarding pain and recognition of pain. And when we all come together, we bring our specialties. So what has been interesting for me, having the opportunity to work with different professionals, is what we bring to the table. So physical therapists, I think your education and what you learn is phenomenal. There's not a question about it. I have great respect for what you do, and in fact would love to have a physical therapist work with us at school, but unfortunately you're a little more expensive than we can afford at the moment. But you bring a ton of experience. The difference with what you were saying is that there's no question that you, as far as having knowledge of the modalities and techniques, hands down, you are the experts at that in treating for physical therapy for people. So, you know, your basic, you know, education is for humans, treating humans, and there's great value in that when we look at comparative anatomy. But let's not forget, when we work with veterinarians, veterinarians also bring to the table what we went to school for, which is our knowledge of physiology, pathophysiology, biomechanics, biochemical changes in animals. And so my view is that it actually makes me sad that we're arguing against each other, who's better or worse or who's qualified or not, because when we work together, I think that's where we do the best. We bring our knowledge and create the best approach for those patients, but also recognizing that there's value in each areas. And I do think that it's really important that we work together as a team, because there are a lot of avenues in animal, welfare and animal physiology that are unique, that we do go to school for quite a long time to learn. And I think, that's the key for us, is working together. But I think when we try to separate, that's the problem. So back to the issue of, education-wise, not a question. You definitely learn anatomy, all the modalities for people. Pain recognition, I wanted to talk about because you brought that up, is not simple. It's really complicated. That's my area of research. And you can't just learn that just for people and apply it directly to animals, because there's actually, we're doing a study right now looking at the difference in people and children in nonverbal communication, comparing that to different animals, not only just dogs and cats and horses, but other species, which is something I think I would love to include. What we're talking about, what particular species are we all going to be treating as well? And so the nonverbal, while PTs are trained in nonverbal, so are MDs as well. MDs have the same education as far as what you described, knowing, diagnosing, treating for people. But that's people, and I don't see the MDs currently requiring to treat animals after some advanced certification all by themselves. I think that's very dangerous. I think it's a bit of a slippery slope for us, because I think, again, I get pulled into a lot of these interprofessional research groups as well as clinical groups to treat pain in animals. I work with biomechanical engineering groups that are orthopedic surgeons, and they bring a veterinarian into the group because of what we know about animals and applying it to different species. Because I agree with Dr. Cho said about the anatomy. I have to agree with you that there are tissues that are similar throughout different species. You're right, skeletal, bone, a lot of similarities. That's where comparative anatomy and physiology is amazing. But it is very different between, having a solid tissue all alone and in a working animal. Very different. You're right, certain joints, when you look at them all by themselves, yes, they could be similar to a human, but you compare that, a biped to a quadruped, it's quite different. That knowledge is very different. In fact, we have dedicated laboratories, that's the research. Dr. Sue Stover, her amazing research lab, is dedicated to looking at the locomotion and the differences in biomechanics in quadrupeds. So I think that, I wanted to just address that. I don't think that there's any, the PTs have an amazing education. I respect what they do. I love working with them. I think the same of my MDs as well. But I don't want to forget about us veterinarians, that we have a certain skill set that we bring to the table. And when we all work together as a team, not separately, not fighting, not, letting anyone have no supervision, meaning I can see orthopedic surgeons, they do a lot of training in surgery. They do more years in residency than our boarded surgeons for veterinary medicine. So should we give them a couple weeks in advanced coursing, learning about animals, and then let them do surgery on animals now? It's a very slippery slope. Again, emphasizing, I respect all the different professions, but I think that we really need to be careful comparing humans and animals. They are quite different in some ways, and if we stay together and work as a team, we'll always be able to focus on the patient care and the best client care.
Very well said.
Thanks.
I think I already know you didn't like La La Land, I'm sure. You don't have to answer.
I'm Jeff Smith. I'm a veterinarian from Lake County, private practitioner. I also do have the extra credential of the CCRP training. I just want to speak to the question of the human training and its applicability to animals. I think that there are dramatic differences between humans and animals, and to not acknowledge that, I think, is a little bit naive. For example, muscle recovery is much different in a horse than it is in a human. Animals obviously are quadrupedal versus bipedal. Forces are distributed much more differently in the limbs than they are in humans. Animals walk on their toes, not on their heels as people do, so that is a whole another biomechanical issue. And that list goes on and on, but I think that it's dishonest to suggest that learning human anatomy, physiology, pharmacology qualifies you to address all these differences that our animal patients have. I think that suggesting a human-trained physical therapist should be able to independently practice on animals would, by extension, allow human dentists to perform veterinary dentistry, or human surgeons to perform veterinary surgery, or human psychiatrists to perform animal behavior. And obviously that does not wash both ways, and that makes sense, right? Because there's a whole base of knowledge that is required for treating the different species. I think if crossing from human care to veterinary care were sanctioned, then the reciprocal should also be sanctioned, and I don't think anybody here would argue for that. I doubt that Dr. Sims would say, oh, you veterinarians with a little extra physical therapy training, you should treat humans, because the argument really would essentially be the same. Clearly, the reason we have distinct human and veterinary fields is because each require their own extensive knowledge base, their own specialized equipment and facilities, and their own insurance and regulatory compliance. So I have other points, but I think that speaks to the idea of the human versus the animal training, and I just wanted to give a perspective of a private practitioner.
Mr. Chair.
Let me just finish with public comment first.
Well,
Did you want to?
It's just a point of order type thing. I think you very much got to critically listen to comments and make sure they are in order.
What did you say?
That the comments are in order, and that's just commenting about physical therapy education, not comparison. I think we're going to have some speakers talk about certification in terms of the knowledge base of the physical therapist entry-level education to the animal rehabilitative world, and those comments are being made here prematurely by the public.
Okay. Other public comments?
This is on the narrow issue of qualifications.
Correct.
Therapist
Yeah.
or licensure.
Yeah, members of the public are reminded that this is specifically on the educational and training requirements for physical therapists. If you feel it addresses that issue, then please come forward.
All right. Hello, my name is Kelly Boyston. I am a California licensed physical therapist and a certified equine rehabilitation therapist. I am also a registered veterinary technician. Just want to thank the Animal Rehab Task Force for your hard work this last year in dealing with this very complex and difficult issue, and for allowing me to speak today. In regard to the physical therapy curriculum, the curriculum to obtain a degree in physical therapy is heavily based on musculoskeletal anatomy and physiology, includes extensive education on critical thinking, assessing pain in verbal and nonverbal patients, manual palpation and assessment of joint mobility, muscle length, tension in verbal and nonverbal patients, the correct use of modalities like electrical stimulation and ultrasound, not just how to apply them, but much more importantly when and why to apply them, and formulating a treatment plan based on the outcomes of these assessments. The curriculum, or at least my curriculum for a registered veterinary technician, contained none of this. The transition from human musculoskeletal anatomy to animal is much less difficult than one might think. Once you learn joint kinematics, joint biomechanics, accessory joint motion, length, tension relationship in muscles, proper exercise prescription specific to an injury, and pathology in a human, the transition to canine or equine is actually quite easy. That is not undermining what veterinarians know. I'm speaking specifically to the rehab portion of what we're talking about. This is achieved for physical therapists with our advanced training, which we're going to be talking about. Physical therapists who have advanced training in animal rehab do receive the necessary education to recognize medical red flags, and we are trained to refer such patients back to the veterinarian for further workup. If medication changes are necessary to manage pain, a phone call is made to the veterinarian so that the patient can get the medicine that they need, as per the veterinarian order. We have advanced training in PTs who have advanced training in animal rehab are taught proper animal handling skills and restraint. And again, we're going to talk about that later. We are very trained as physical therapists to work in a medical model where we are part of a collaborative team. So I just wanted to say that. Thank you very much.
Additional comments on specifically the training and education that physical therapists receive? We're not talking about additional training that they may receive.
I just have to ask the question because I don't have any medical basis to know all these words and stuff, but I don't want you guys to make a decision on what I want to say until I've said it. So I don't know if this is the time to say it or not.
You've been looking for that time all day, haven't you?
Oh, no. Okay. So I also wanted to say I do appreciate all of you taking the time to address the issue. I think everybody here loves animals. I know that everybody has a different way of how to show that, but I do appreciate that part. And I was going to try and do this without reading, but I can't, so here we go. In order to give us consumers access to care for our animals, I ask that you, the Animal Physical Rehabilitation Task Force, approve...
I'm sorry, I'm going to interrupt real quick. Can you introduce yourself?
Oh, yeah, that's right. I am Sharon McDonough. I'm from Southern California, and I'm just a consumer. Thank you. I ask that you, the Animal Physical Rehabilitation Task Force, approve a motion that physical therapists with advanced training and certification in animal physical rehabilitation be able to practice animal physical rehabilitation under the indirect supervision of a veterinarian and not be restricted to a veterinary premise. I believe that, in fact, having the trained physical therapist around animals could actually head off a potential bad situation because they are more in tune to the signs that I and other lay folks may miss. And I have a case in point. I had a situation I underestimated in seriousness with my 2 cats. I knew they were not acting normal, quote unquote, so I called my physical therapist friend, who also had been trained and certified in animal rehabilitation, and described their behaviors, and her recommendation was to take them immediately to the emergency vet hospital. It was on a weekend. It was like 7 o'clock at night. She said, take them. It turns out one had an acute hypertensive episode, and the other had a urinary blockage, and both had to be spend the night in the hospital. And I wanted you to know, please, that my physical therapist friend immediately saw the value in having a veterinarian diagnose and treat my animals, and that it is this team approach and mutual respect that will lead to the best access of care for our animals, and as a consumer, that is the best of all worlds. And I hope it was the time to say it.
Thank you so much for your comments. What are the names of your 2 cats, and are they okay now?
They're okay now. Agent takes medicine, and pill pockets work great. Don't have to stick them down the bad way anymore.
Yes.
And Newton, he's a little chubby, but he's peeing just fine.
Very good. All right. Any other comments from members of the public in regards to educational and training requirements of physical therapists? So I think where the discussion is now going is going to be specifically to talk about this additional training that physical therapists may receive in order to practice physical therapy, respecting the fact that no motion has been made. And it might be a good time to break for lunch. So I propose that we break for lunch. It is, I have, 8 minutes to 12, yes. So we will resume at 8 minutes to 1.
Thank you for your precision, Chair Nunez.